and welcome to another Top Doctors online interview where we speak to one of our leading specialists. Today, we are very lucky to be joined by Mrs Kalpana Devalia, a highly respected consultant bariatric surgeon, to discuss a fascinating topic, bariatric surgery tourism and the potential risks of undergoing weight loss surgery abroad. So welcome, Mrs Devalia, and thank you very much for joining us today. Would you like to introduce yourself and tell us a little about your background and your areas of expertise?
Thank you. I'm Kalpana Devalia. I'm a consultant bariatric surgeon. A large part of my practice is weight loss surgery, but I do offer operations for other conditions such as gallstones, hernia, and acid reflux disease. These are all primarily performed with a keyhole technique, also called laparoscopic surgery. And I'm based in London.
Thank you very much. We're delighted to have you with us today. So as I mentioned, we're here to talk about traveling abroad to undergo weight loss surgery or bariatric surgery, as it's also called. And that is something that's becoming more and more prevalent and an option that patients looking to undergo this type of surgery may well be considering at home. So to start off, Mrs. Devalia, could you tell us why people travel abroad for bariatric surgery and how common this is?
So, it is becoming increasingly common for people to go abroad for bariatric surgery. And there's actually a term for this, so it's called bariatric tourism. Now, the reason we are seeing an increasing surge of patients going abroad is primarily because they're feeling being let down by the NHS. There is a growing need and lack of resources to offer surgery to these patients. And it unfortunately is still a postcode lottery, depending on where the patient lives, whether they'll be referred to the NHS hospital or not. And for those who are eligible and are accepted under the NHS to have their bariatric surgery, often wait for months or years before they can actually have their operation. So in addition to this, if they have to consider going to a private sector to have their surgery a bit quicker, it is extremely expensive compared to the overseas option, which is significantly cheaper and more affordable, and also very attractive because they can combine a holiday with having an operation.
So, Mrs. Devalia, what are the potential dangers of traveling abroad for this type of surgery?
So in the UK, bariatric surgery is very tightly regulated, and for the right reasons. We have processes in place to ensure high standards of care that the patients need to protect them after their surgery. So the providers are regulated, are regularly inspected by a governing body called the CQC, which stands for Care Quality Commission, to ensure these high standards of care. Also, the surgeons who offer surgery have gone through rigorous training and have their outcomes published on the national database. So when one goes abroad, it is extremely difficult to ensure that all the safeguards are in place.
So as a specialist in the field, what are your concerns?
My biggest concern is the lack of bariatric care that these patients need in terms of holistic care. And by this, I mean adequate preoperative preparation, counseling, education by a specialist bariatric team, which not only includes a surgeon, but has a specialist nurse, a dietitian, a psychologist, a physiotherapist, a physician, anesthetist, who all come together to ensure the best care for the patient, and also a long-term follow-up, which is an absolute essential criteria for long-term success after the surgery. And there is a growing assumption that when the patients go back to their country, the NHS will sort out the problems. And unfortunately, there is lack of awareness that in the UK, there are not enough NHS trusts which offer a specialist bariatric surgery. And in the centres where we offer bariatric services, we are seeing an increasing number of patients returning from abroad requiring emergency admission for complications after their surgery. So this is obviously a serious concern.
So, Mrs. Devalia, somebody listening at home may well be considering their options and making a decision about where to undergo weight loss surgery. What advice would you give someone who was considering traveling abroad for bariatric surgery?
So if one is considering traveling abroad for surgery, you have to consider a lot more than just the cost and the quality of surgery. Of course, you have to check the surgeon's credentials and outcomes, but also check whether the provider has adequate support for providing education before the surgery. There is adequate counseling. There is post-operative follow-up care included for short-term and long-term complications. And one also needs to be aware that there is an increased risk of developing clots in the legs, which is called deep vein thrombosis. And if this clot, if it goes to the lungs, which is called pulmonary embolism, it can be a serious complication, and there is an increased risk related to travel. They should also make sure that they have all their medical records available to them on discharge. And one needs to be aware that a compensation for an uneventful complication may be extremely difficult if the surgery has been done abroad.
Okay, so finally, there are perhaps some common misconceptions about weight loss surgery, in that maybe it's a quick fix for those looking to lose weight, but specifically to preparing for surgery and the recovery period which follows. Are there any aspects of undergoing bariatric surgery which patients might not expect?
You're absolutely right. There are a lot of misconceptions, and it should definitely not be considered as a quick fix. It is an extremely difficult decision for patients who are taking it very seriously and considering bariatric surgery. It is not easy. Peri-operative preparation presents an extreme challenge for these patients. And by this, I mean, pre-operative preparation with education, counseling, gathering all the information, understanding the risks and complications of this surgery. And also a continuity of care and long-term follow-up are absolutely essential for a long-term success for sustaining the weight loss. And as I mentioned earlier, this is provided by the bariatric team, which consists of the surgeon, the dietitian, the psychologist, physiotherapist, and physicians, which one requires as for initial preparation and for long-term follow-up. So in the NHS, we do offer patients a 2-year follow-up, and they're monitored very closely to make sure that they achieve the results that they expect to achieve. And then they also require a long-term follow-up with their own GP on an annual basis.
Thank you so much, Mrs. Devalia, for sharing your expertise and advice, which I'm sure has been extremely helpful for anyone at home weighing up their options for bariatric surgery. So many thanks for joining us. I'd just like to remind anybody who's considering undergoing bariatric surgery that they can schedule an appointment with Mrs. Devalia by visiting her Top Doctors profile. You can find us at www.topdoctors.co.uk. Delighted to have spoken to you today, Mrs. Devalia. Thank you so much.
Thank you for having me.